So, hello friends. Today we are doing a stenosis decompression for L5S1 middle zone stenosis, in which we have decompressed this foramen and the anterior part of the canal. This is the disc which was pushing the dural sac posteriorly. So, this is the dural sac which has been decompressed in the anteriorly by removing this disc. Laterally, we have removed part of overhanging superior articular process. You can see bit shaved pieces of superior articular process here, and there was a ligamentum flavum layer covering this superior articular process. So we have also removed this. After removing, you can see how beautifully our traversing S1 nerve is decompressed here, and you can see that there is some ligamentum flavum in the upper zone, and this is the L5 exiting nerve root that you can see at 3 o'clock position. This is the exiting nerve root, which is quite free. It is not being compressed by this ligamentum flavum. There is lot of space over here, so I am not removing this ligamentum flavum altogether. I am just seeing those nerve roots. This is the L5 nerve root that you can see here freely moving, and that is the S1 traversing nerve root. Both nerve roots are very well freed up by this transforaminal surgery under local anesthesia. If in case you want to remove this ligamentum flavum, left curate piche, that can also be easily done. I'll just demonstrate how we remove ligamentum flavum from the top of exiting nerve roots. So here is the exiting nerve root, and you use a left curate for the right side surgery. So we are doing a right side surgery, so we are using this left curate, and just go above that nerve root and scrape this ligamentum flavum off from here. Okay, so this is very easy to reach this hidden zone of McNabb by transforaminal surgery. You can see how easily I am removing this ligamentum flavum. This has been loosened up, and the roof of the exiting nerve root has been cleared by this maneuver. Up biting rasper. Up biting. वो उधर है, कौन है? आखिरी वाला. Black grasper is nice one. So this is how we first loosen the ligamentum flavum, and then we can pull it out. First loosen, then pull it out. I hope you can appreciate that this is the area of exiting nerve root, which is quite free now, but I'll just remove this fat to show you how the exiting root looks better. Okay, so this is the region where our exiting nerve lies, that the fat you can see which is coming out, and it is quite free now. Okay, so we don't need to do further decompression for the exiting root. This was a case of middle zone stenosis, so we are just focusing on the middle zone here, and exiting root was already free. But if in case you have upper zone stenosis, you can easily remove the ligamentum flavum by a transforaminal approach. Up, सीधा curate. Pressure please. Black grasper. Flexible grasper. In this part we are just removing the ligamentum fleum from the axilla. I hope now you can appreciate the decompression of axilla over here, that we have removed lot of ligamentum fleum from the tip of SAP. So our traversing L5, traversing S1 nerve and the exiting L5 nerve lying over here is very well decompressed. Okay, so this is how we do stenosis by transforaminal approach. Okay, welcome.